Okay, let's start. Today we're gonna start the new topic. It's a topic dedicated to intestinal infections. And the first infection we're gonna discuss today is dysentery, or intestinal infection caused by Shigella germs. For a small introduction, maybe you know, maybe you suppose, but this is the classification of the most frequent infections. If you will pay attention, you will observe that mostly common infections will have on the first place airborne infections or respiratory tract infections. And if you will simply calculate, you don't need to look for data, for statistics. If you will simply calculate for how many times in your life you've got respiratory infection, you will understand that this one is the mostly common one. Because each of us, every year, can get infected with a respiratory infection, and not once, right? Not too often. It could happen that in 1 year I will never get a respiratory infection. Maybe all of us had such a year in our life. But basically, it is a kind of season stuff. And it is almost impossible to not get infected with a respiratory infection. Why it is so? First of all, because all of us are breathing. All of us are breathing at the same time. All of us are breathing without any breaks, without stopping. So, both sources of infections and receptive population are all the time producing and all the time exposed to get infected with a respiratory infection. Since both sick and healthy people are breathing all the time without any breaks. And since we are social, humans are social species, and we cannot break our social connections 100%. Yes, sometimes it could happen. We separate to each other, maybe by purpose, maybe it happens just because. So all the time you will have a source of infection around. This is what makes everyone basically to be extremely receptive to respiratory infections, and this is why these infections are the mostly frequent ones. On the second place, we have fecal-oral infections. If we are talking about mechanism of transmission, it is fecal-oral. If we are talking about nosological form, or how it manifests, it is intestinal infection or food poisoning. These infections will be on the second place, and again, you can compare with your life. And I'm pretty sure that all of you, all of us had ever an intestinal infection. And if you don't know what is an intestinal infection, you can just calculate for how many times in your life you've been consuming something spoiled, something not really fresh, and after that had stomach ache, maybe fever, maybe headache, but mostly diarrhea and maybe vomiting. And you will observe that it happens in our life from time to time. Not that often as respiratory infections, but from time to time it happens. We get an intestinal infection or food poisoning. Why it happens? Again, because all of us are consuming water, drinks, foods, not all the time as breathing, not without any breaks, hopefully, yes. Some people have more specific habits and they're consuming all the time in any place, maybe even during the lecture instead of listening, taking their meals, yes? So it happens that we consume every day something, and not every time you can control the food production from the very beginning till the moment of consumption. Sometimes, if it is up to you, if you're producing everything, you can take it under control more. If you don't produce it yourself, you just buy prepared products, prepared foods, you cannot control it because a lot of people have been participating in production of this food. This is why it can happen to us to get an intestinal infection. But still we consume something daily and not once, most of us. On the next place we'll have infections acquired by contact, direct contact, indirect contact. Direct contact when you have skin-to-skin contact with the source of infection. Indirect contact when you touch or keep or take something the source of infection touched before. This one is called indirect contact. So even if you are sociopathic and if you are trying to separate yourself as much as possible from society, at least by indirect contact you cannot avoid such infections. And if you will observe in your life, you also had some skin infections probably. And when I'm talking about skin infections, I'm not talking about something extremely dangerous and aggressive. Same pimples are kind of skin infection. It is a small, very small inflammatory process that happens to all of us. So starting from such small inflammatory processes and continue with something more serious, it depends how selective you are in touching everything and in walking around. It will depend how much affection you will get from the environment or from other people with pathogens that can cause skin infections. But still you cannot separate yourself totally or 100% from the environment and from the society. And on the last place, last but not least, it is very important to mention this category of infections, parenteral infections. If we are talking about mechanism of transmission, if we are talking about nosology, it is about infections of soft tissues, and it is about bloodstream infections. So, whenever we are talking about parenteral infections, that means it is a pathogen that got into our body, inside of our body. And now pay attention, inside of the body, not on the surface, but inside of the body, but not through the intestinal tract. Why it is called parenteral. This root para means beyond or nearby. If you heard about Paralympic Games, we have Olympic Games and we have Paralympic Games. What means Paralympic Games? Kind of Olympic Games, but for people with disabilities. So, nearby Olympic Games. So, this root, para, means beyond or nearby. So, parenteral route of transmission means something that gets inside of our body, but not through the intestinal tract. That is mostly common way for something to get inside, but beyond bloodstream. And basically, usually it is about skin lesions or lesions of soft tissues. As a result, it will produce either either soft tissue infections, either bloodstream infections. It depends how much it will get in our body and by which specific gate it will enter. So if we are talking about, if we start talking about Enterobacteriaceae, that is a big family, it is a very large family of pathogens, of microorganisms. Enterobacteriaceae gathers together a lot of genuses and species of bacteria. Some of them are normally present in the intestinal tract of humans, and some of them are pathogens of the intestinal tract of humans. Some of them are normally present of intestinal tract of animals, birds, and some of them are pathogens. This is why some of them will make part of mandatory pathogenic flora or strictly pathogenic flora, and some of them will make part of conditionally pathogenic bacteria. Why it is that important to have different methods of investigation in microbiology? This is one example why. For example, if we would have just microscopy, and we would be able to see all of the pathogens under the microscope, and that's it, without any other ways, any other methods of diagnosis, investigation. We have just microscope, and we make a smear in which we can find different representatives from the intestinal tract, different representatives from intestinal infections. For example, Shigella, Salmonella, Escherichia. These three are mostly common pathogens that can cause an intestinal infection. So if you will make a smear to look under the microscope and you will apply just gram staining to see these bacteria, how do you think, will you make any difference under the microscope between all of these bacteria? Between these different genuses, I'm not talking about species. You will not make any difference. You will not make any difference between Shigella, Salmonella, and Escherichia if you will just see them under the light microscope by gram staining. In any case, you will see rod shape, gram negative, non-spore forming bacteria. So you will see red rods. That's it. Meanwhile, it can be any representative from the family of Enterobacteriaceae. And you remember, in taxonomy we have family, after that genus, after that species, and sometimes after species we can have or subspecies, or serovariants, or biovariants, but under family you will have also more types of bacteria. So you will not be able to see any difference between them. This is why it is that important to have other types of or other methods of investigation. And this is why one of the mostly common methods of investigation in intestinal infection is bacteriological one. And you can remember, first of all, if you get an intestinal infection, probably you are not going to a doctor, right? Who did ever go to a doctor having an intestinal infection? Did you? I guess you're doing your best to not leave your house, right? Because nobody knows. Will you arrive to a doctor or not? First of all. And second, it happens often enough in your life, not too often, but often enough in your life, in order to be sure you will be able to settle things down. This is why whenever we have an intestinal infection, we are just doing our best to be as closer as it possible to bathroom. Yes. Now, if these pathogens are that common, if this kind of infection, this nosology, is that spreaded all over the world, that means we need a fast method of investigation and specific one, because pathogens are a lot, incidence is high, so we need a universal method of investigation. Bacteriological method of investigation will be the best one. When we compare, for example, microscopical and bacteriological, why bacteriological is more specific cultivation of bacteria. You don't see bacteria under the microscope. You see just, in the best case, you can see colonies on the culture media, but you cannot see the bacteria. How can you be sure you will make diagnosis better without microscope than with microscope? Just as I told you. If you see them under the microscope, you will not see a big difference between them. That's interesting that some things it is easier to see from a side, from a distance. It is easier to understand some things. And one of my favorite comparisons is how can you understand more about a person? By picture on Facebook or Instagram, or by seeing that person in real life. In real life, you can understand more about that person. Okay, maybe you don't see that person too close, but sometimes from a side, from a distance, you can see much more and it can be much more informative, because people, they try to look better than they are, but it is not about you. Right now, you are just as you are, and I appreciate that so much. So, usually people are trying to fake their appearance. People are trying to mask their appearance by different filters, they make smear fixation on Instagram, and that's it. You will not see any other features of the person. You will see just that thing. You can just that moment the person decided you will see, not you. Same thing happens in microbiology. If you can see just smear fixation, just the bacteria in the moment, you will understand size, shape, arrangement, same thing as in social media. But when you can see the activity, what the bacteria is consuming, what bacteria is producing, when you can see the person in the real life, what person prefers to consume, and right now I'm talking not necessarily about foods, what you consume. When you are going after a lecture, what do you open? Okay, not after a lecture. What are you looking right now in your phones? I'm pretty sure not microbiology and not other materials. Right? Probably you found some interesting memes, right? On Instagram, on Facebook, that makes you extremely happy with your colleagues, but not microbiology. What does it mean? I already can see what you consume right now. As a result, I can suppose what you will produce on the lecture or on the lesson, on the practical part. I can already. I'm almost sure which will be the result of our discussion on the lesson. Because what you consume, this is what you will produce. There is no chance you will consume now something useless, but during the lesson, instantly you will become smart and will give the best answer. This is what happens in bacteria. When bacteria is cultivated on special culture media, on selective culture media, on differential culture media, this bacteria will produce different substances, because this bacteria will consume different substances. Some bacteria prefers one kind of sugars, other bacteria prefer other kinds of sugars. So, as a result, the metabolic results of bacteria, the metabolic products of bacteria also will be different. As a result, they will produce different chemical substances that will enter in a contact with the culture media and will change its acidity, will change its chemical composition. As a result, the culture media will change its color, and you will understand what bacteria consumed and what bacteria produced. This is how you use selective and differential culture media for diagnosis. Talking specifically about Shigella and about dysentery. As well as you can see, the pathogen that causes dysentery is called Shigella dysenteria. But there are different types of dysentery having different origin. So classically, microbiologically, we have only one dysentery that is caused by Shigella dysentery. But in society, we are used with the idea that dysentery can be caused by different pathogens. So dysentery can be caused by parasites, dysentery can be caused by bacteria, and specifically Shigella, by viruses, and by other different pathogens. When you say dysentery, what do you mean? Specifically, two features of this kind of intestinal infection. First one, strong watery diarrhea, but please make difference from cholera, that gives strong watery diarrhea without any changings. It is just transparent, almost whitish, but transparent liquid. That's it. But when we are talking about strong watery diarrhea in shigellosis or in dysentery, it is strong diarrhea, watery diarrhea with the contents of the intestinal tract first. And after that, when the disease eliminated the entire contents of the intestinal tract and basically of the large intestine, it is empty already. So it starts producing mucus with blood. It's in small amounts. So as a symptom, the person wants again and again, this symptom is called tenesmus. Tenesmus is a painful feeling when you think you want to go to a bathroom, you want to produce something, yes? And everything you get is a little bit of mucus and a little bit of blood. That's it. Because the large intestine already is empty. So it is not able to produce anything. But still, there are some contractions that are giving you a sensation that you are going to produce again and again. So these two stages of dysentery. So when we are talking about morphology of Shigella, even if basically morphology of all the Enterobacteriaceae representatives is very similar, but there is something that makes Shigella different from other relatives. And the mostly specific feature is it is non-motile. This is why you should keep in mind that other representatives like Salmonella, like Escherichia, they are motile. They have flagella and they are motile. But when we are talking specifically about Shigella, Shigella is non-motile bacteria. So this is why it is situated specifically just in one part of the large intestine. But what is in common in their structure? All of them, they have this pili. Do you remember what is pili? These are non-permanent bacterial structures that are playing a role of anchor, attachment for surfaces. Yes. So it is for attachment to tissues, specifically to mucous membranes. This is what helps bacteria to not get out that fast from the intestinal tract, but to keep attached to the mucous membrane. This factor also influences the inflammatory process that appears on the surface of the large intestine. Also, these bacteria will start producing a toxin. It is called Shiga toxin. And as a result, it will not just produce diarrhea. What happens when we have inflammatory process in the intestinal tract? All those 5 signs of inflammation, rubor, tumor, dolor, color, funcțiilese. That means redness, you will not see it, but believe me, it is there. Tumor, also, you will, inflammatory process. You will not see it, but it is there. Color, that means local temperature increase, same thing. You will not see it, but it is there. Pain, you will feel it. And dysfunction of the tissue. Which is the function of tissue, of the intestinal tissue? Which is the function of the tissue of the large intestine? Simply, function of the large intestine is absorption and basically of water. Small intestine is absorbing water and nutrients, and large intestine is absorbing rests of water from the feces to be. So all the extra water from that amount of future feces is absorbed in the large intestine. When we have dysfunction of large intestine, what does it mean? We have dysfunction of absorption. We don't have any absorption properly. Of course, not the entire surface of the large intestine will be affected, so partially water will be absorbed, but partially it will not be absorbed. As a result, we have irritation of the large intestine. As soon as we have irritation of the intestine, we have stronger contraction. We have stronger motility of the intestine. As soon as we don't have enough absorption and we have higher level of motility of contraction of the intestinal tract, we have diarrhea, because it pushes all the contents of the large intestine without sufficient absorption. That this is what makes feces to be liquid. It pushes out. So after the entire contents of the large intestine is out, after that, what do we have? Large intestine is empty. Inflammatory process is continuing, is ongoing. Mucus is produced, and since we have irritation and inflammatory process of large intestine, we have damage of mucous membrane that produces in the beginning small bleeding that can evaluate to bigger ulcer, perforation, strong bleeding if we don't treat it. If you don't apply proper treatment on time, it can lead even to perforation, to peritonitis, to abdominal bleeding, to sepsis, and to death. And it develops very fast if you don't start treatment on time. So this blood that is produced during inflammatory process in the large intestine will be eliminated with mucus after elimination of the entire contents of the intestinal tract. This is what makes Shigella and dysentery specific and different from other intestinal infections, because I'm pretty sure not all the time you've got an intestinal infection, after that you had also blood in feces, right? That means either it was a kind of food poisoning, which is the difference between food poisoning and intestinal infection. Difference between food poisoning and intestinal infection is the following one. How you get an intestinal infection? You take foods or water, drinks, something that contains bacteria. You consume it. This bacteria starts multiplying in the intestinal tract, produces inflammatory process. Here's the infection. If there is bacteria that gets in food, multiplies in food, produces some toxins in that food, after that also dies in that food. You consume that food. You consume what? Toxins. This is why it is called intoxication or food poisoning. Because there is no inflammatory process, classical inflammatory process caused by bacteria, but there is affection caused by its toxins. This is the difference between between infection, intestinal infection, and food poisoning. Is it clear? So sometimes it could be food poisoning, sometimes it could be an intestinal infection, but specifically in dysentery, this small but very important sign of bleeding after elimination of the entire contents of the intestinal tract will suggest us that probably the pathogen is Shigella. Also, we have some intestinal infections with the same symptom, and this is why some people used to call dysentery generally all the intestinal infections with such symptoms. But specifically, Shigella dysenteria is producing this disease. So for diagnosis of this bacteria and for diagnosis of each intestinal infection, usually we apply in bacteriology two steps. Two steps are enough for bacteriological investigation and for differentiation of the pathogen. First one is applying of selective culture media in order to find a pure culture. But what you should keep in mind that selective culture media has double function. It is at the same time selective and differential. Because on the selective culture media, what makes selective culture media to be selective? Selective culture media contains specific antibiotics that prevent growth of other bacteria that potentially, not potentially, but actually are present in the specimen. So when we have an intestinal infection, we need to find the pathogen. In order to find the pathogen, we need to take a specimen where the pathogen can be present. In case of intestinal infection, we are talking about feces. We take feces for bacteriological investigation, and what you find there? More bacteria than the fecal matter, actually. So, too much bacteria in feces. Why? Because it is normal. It is something normal for feces. It is something normal for intestinal tract to have a lot of bacteria. The mostly populated by bacteria place in our body is intestinal tract. On the second place, oral cavity. On the third place, skin of our palms. So, the mostly populated place is intestinal tract. We take some feces, we put in simple culture media. There will grow everything, and you will not find the bacteria you are looking for. How works selective culture media? You take selective culture media, the mostly common one is McConkey agar. It can be also endo, Levin, and so on. So these culture media, they have function to inhibit growth of normal flora of the intestinal tract. How? Mostly, not all of them, but mostly of the intestinal flora are gram-positive. And most of pathogens that are causing intestinal infections are gram-negative. Shigella, Salmonella, Escherichia. There are mostly common pathogens causing intestinal infections, and all of them you can observe are gram-negative. Now, selective culture media will inhibit growth, will inhibit multiplication of gram-positive bacteria. it will contain antibiotic against gram-positive bacteria. As a result, in this culture media will multiply only gram-negative bacteria. Some of them still can make part of normal flora because say Escherichia coli, it is a normal representative of the intestinal flora of each of us. But sometimes it can turn, some serovariants of Escherichia coli can turn into pathogenic and can produce an infection. So this culture media will not detect the only pathogen or the only bacteria we need, but it will eliminate all the bacteria we don't need for sure. And it is the first step of filtration of the bacteria. After we obtained mixed culture of different gram-negative bacteria obtained from our intestinal tract, we can make difference on this culture media. We will not see it, but because probably as well as I can see, this culture media is taken not from the intestinal tract, because we don't see here different colonies, different colors, different sizes, different morphological characters of colonies. All the colonies are looking seem to be the same. That means that probably this specimen have been taken from blood. This is how you make difference already on the culture media where it was taken from. Because if it is taken from a place that normally is not populated with bacteria at all, that is supposed to be sterile completely, and the person has infection and the pathogen is in that place, for example, bloodstream infection, in this case, we will find only one species of bacteria. Now, if we take a sample from the place that normally is populated with bacteria, that is intestinal tract, oral cavity, our skin, mucous membranes, respiratory tract, these places are normally populated with normal flora. So in this case, for sure we will find more than one species of bacteria. This is why selective culture media, this is how selective culture media will help us to eliminate all the bacteria we don't need for sure. And the next stage, the next step we have is applying of differential culture media. So first of all, what makes selective culture media, say McConkey agar, makes it at the same time selective and differential? Because it also contains some chemicals that will enter in the reaction with metabolites of different bacteria and will change the color either of the culture media around the bacteria. And you can see here the color of culture media is closer to red, and here to something between rose and purple, right? Because this bacteria is able to change the color of culture media and or can have a different color of colonies. This is as a result of metabolic processes inside and around the bacteria. So if we would have here different species of Enterobacteriaceae, different genuses and different species, we would see different colors of colonies, different colors of culture media around colonies, and by these features we would be already able to understand or to pretend to guess which one we need. So we take with bacteriological loop, we touch just that colony we need. We take differential culture media. Here you can see an example of TSI agar, triple sugar ion agar. That means it contains 3 kinds of sugars, and iron. So it will help us to understand which is the metabolic potential of the bacteria. And you can see on these pictures that independence on which species we have, they will produce different changings in culture media. Some of them will consume just one kind of sugars, some of them will consume just two kinds of sugars, some of them will consume three kinds of sugars, some of them will consume iron, and some of them will not. As a result, some of them will produce H2S and will change the color from pink to black. Some of them will change just to yellow, that means they consumed the sugar. Some of them will consume all sugars and will consume iron. Some of them will consume iron but will not consume all sugars. And some of them will produce gas. You can see here rupture of the culture media. So that means that gas produced by bacteria made a rupture inside of culture media and made a space between two halves or two parts of culture media. So all of these metabolic features will help you to understand or to make difference between different species. This is why they are called differential culture media. So this is the mostly common way of investigation for intestinal infections. Of course, if we are talking about treatment, before we apply any antibiotics, what should we do? We should provide liquid replacement. That means we should estimate how much we lost, and we should replace at least same amount, but better a little bit more.
Yeah, because the patient may lost a lot of liquids, so
Yes.
to enter in dehydration.
Yes. First of all, we need rehydration. Second, the process didn't stop, and the diarrhea can repeat. As a result, on the one side it is good because part of bacteria will be eliminated faster, but still we need to provide liquid replacement in order to help the organism to fight with infection. Because if we don't have absorption, we have just liquid loss. The volume of circulating liquid in the blood is falling down, and it is extremely dangerous, especially for children. It is very important to keep in mind that liquid loss as a result of intoxication, as a result of intestinal infection, liquid loss can be fatal, can be mortal for children. Why is that important to pay attention to that? First of all, they are small. And that amount of liquid the child will lose, you are not exposed to compare with the dimensions of child. Because if the child will lose same amount of liquid you are losing during diarrhea, you will just feel a little bit dizzy. But for child it can be extremely dangerous. First. Second, when a child has intoxication or intestinal infection, it is very hard to force baby to drink. It is very hard because the child is apathic. So it is very important to observe it in the very beginning, because if already you have this apathic behavior and the child is not asking to drink, not everyone is thinking about. Not every parent could think about the fact maybe my baby needs to drink some. They're trying to feed the child and child is not accepting. After that maybe they understand, oh, maybe drinking, but the child already doesn't accept even drinking. So what we need to do in such case? Intravenous. Did you ever try to introduce intravenous catheter into a child's vein during dehydration? First of all, extremely small vessels. Second, a lot of children, they have thick layer of underskin fat, and the circulating volume is low, and it is almost impossible to find that vein. So it can be extremely dangerous, especially for children. This is what you should keep in mind more than other things about intestinal infections. So after we provided ongoing liquid replacement, we are passing to the second line treatment with antibiotics. It is also very important. If you provide antibiotic treatment, you can already guarantee that the process is taken fully under control, both liquid replacement and antibiotic treatment. And of course, any other symptomatic treatment. Basically, in any disease, symptomatic treatment is extremely important. But it is very important also to keep in mind to not make this balance between symptomatic and etiological treatment. What means etiological treatment? Etiological treatment is when you are fighting with cause of disease. Symptomatic treatment is when you are fighting with symptoms. And some people are saying that symptomatic treatment is bad because you just kill all symptoms and you think you are okay.
It's like putting a mask.
Yes, but actually in some diseases, symptomatic treatment is absolutely enough. For example, flu. Symptomatic treatment is absolutely enough. So if you will apply both symptomatic and etiological treatment, you will have an effect, but it will not be different, or it will not be faster than if you just apply symptomatic treatment. But in some cases, indeed, it is not enough just to kill the pain in order to make everything okay. For example, in infections, it is not enough just to apply analgesics. Yes, we need both. Etiological treatment to fight with the reason, with the cause of infection, and after that also is extremely important to apply symptomatic treatment, because when you feel better, when you take rest, for your body, both physically and psychologically, it is much easier to make this rehab during the disease and afterwards. Antibiotics we apply is ampicillin, chloramphenicol, tetracyclines, and so on. One of the mostly classical types of antibiotics. Prevention. I think it is extremely important to pay attention to prevention of intestinal infections. When pandemic with coronavirus started, from each source you've been listening, wash your hands, wash your hands, wash your hands. That is absolutely useless method of prevention of respiratory tract infections, but extremely important and useful in intestinal infections. So what we could observe during COVID pandemic, that while everybody will have been talking about washing hands, incidence of COVID didn't decrease, but incidence of intestinal infection decreased dramatically. So why it happened? Because people found out actually they need to wash their hands. Surprise. Didn't we know? Unfortunately, we realized, but the majority of population, they do not have these hygienic habits. And if you want the proof, please pay attention. Pay attention how many times you're going to wash your hands, or at least taking from a pocket a sanitizer or wet tissues before you start eating. And observe how often you are doing that, and observe how often your colleagues are doing that. Observe how often your colleagues are washing their hands after bathroom, or you. Observe how often you touch different spaces, different places in the society. Did you observe during pandemic we did our best to not touch anything? No doors, no. You're trying not touching anything, and now that's okay. Absolutely, you can touch anything, and after that. So this is what also promotes spreading of intestinal infections. So what I would like to ask you to do is to keep balance between doing and not doing, between touching and not touching, between washing and not washing, because all the problems in this world are because of loss of this balance. Some people are extremely clean. That clean, they have skin issues. They're washing themselves that much, they have skin issues. Not too much such people. So if you deviate, you better deviate towards clean person, not towards dirty one. But please keep balance and think about anything. Think, especially when you will become, hopefully, when you will become doctors. Not all of you, yes, but probably. When you will become doctors, keep in mind, between any contact with anything and with anyone, you must wash your hands. It must be professional habit. It is extremely important. Not just before your meal, also before touching your patient and after touching your patient, because you will enter in direct contact with your patient. These moments are extremely important. So if you will pay attention to these moments, if you will pay attention to prevention, your life will become much easier and much more comfortable. Also, we have some cases when we have vaccination against intestinal infections, but again, if you pay attention to what you consume, when, how, probably you will not need it too much. You will not need too much vaccination. But still, some regions in this world are that.
But they have common.
Yes, yes. Some infections are endemic for some regions, and they're circulating there around population too much. Usually endemic places have no centralized water supply and centralized wastewater systems. As a result, everything is going to the local lake or river, whatever it is, to the local source of water. All the wastes are going there, and all the supplies of water are from there. So you throw there all of your rests and all of your wastes, and you consume the water from there. First thing we need to work with is infrastructure. in such cases. During providing infrastructure, we can, as a temporary solution, we can apply also vaccination. But as soon as we will provide people with clean water and with wastewater systems, you will not need this way of prevention anymore. This is why vaccination is extremely important. It's very useful and good, but for some kinds of infection, there are much more efficient ways of prevention. This is why we shouldn't insist for any type of infection to provide vaccination. Vaccination is the best for airborne infection. It is extremely important. But for intestinal infection, personal hygiene, which I recommend you to keep during your entire personal and professional life. Thank you.